Robotics was once the realm of science fiction, but in recent years, robots have become a common fixture in operating rooms. We spoke with Dr. Samir Hage of Redlands Community Hospital to find out what procedures are being performed with the use of robotics.
Gynecology at this time, a lot of the applications for the robotic surgery include hysterectomies, myomectomies, or removal of fibroids without removing the uterus, repairs of vaginal prolapse, which allows us to suspend. It turns a very invasive procedure called an abdominal sacrocolpopexy, turns it to a minimally invasive procedure where it's done robotically. Same thing with hysterectomies that are more complex with large uteri, for example, or women that want to keep their uteri and have large fibroids. We can perform the procedure a lot less invasive and with less blood loss. As a physician, as a surgeon, I like it because of the amount of dexterity that it allows me. The things I can do with the robotic instruments I cannot do with the conventional laparoscopic instruments. And the complex surgeries that we're able to perform with the robotic, with the Vinci, are a lot more complex than the ones that we can with the conventional laparoscopy. When you take laparoscopic surgery, minimally invasive surgery, and take it to the next step, is when the Vinci robotic surgery program comes into play. What it allows us to do is, I say this cautiously, is take the human factor out, which means take the human, for example, if you're operating a camera with your hands, you're more likely to have a little bit of shakiness with the picture. The picture quality is more of a two-dimensional picture. And the instruments, when you're operating with, they're not as flexible as a robotic instrument. So you add the Vinci aspect, and you're able to go perform more complex surgeries. Surgeries that we would start with conventional laparoscopy at this time, and for whatever reason, difficulty in obtaining access to certain areas in the human body, will force certain surgeons to convert from a laparoscopic minimally invasive procedure to a more invasive procedure, which, as I said earlier, leads to more recovery time, more blood loss, longer hospitalization, time off work, and things like that. Once the surgeon becomes proficient at using the robot and all the functions of it, it can be at least the same time or quicker in certain cases. Again, it depends on the proficiency and how many cases the surgeon has done.
We asked Dr. Hage if the robot takes the place of the surgeon during these procedures.
The surgeon is 100% in control of the surgery. So from a safety standpoint, it really isn't any different. I would say it is actually safer because of the exposure that you're allowed with images that you get robotically. So it shouldn't even be in question. Of course, we have to decide if this is something that we need to do robotically or if it's something that can just be done minimally invasive with conventional laparoscopy. So people are hearing more and more about it, and we just need to make sure that they are candidates for surgery, because not everybody's a candidate for robotic assisted surgery. So people are aware of it.